Okay, this exercise is called extension in standing. It's one of the most effective exercises for the relief of low back pain. It's a practical option for you if extension in lying, which is often a more effective version of the exercise, is just not practical. So often patients will do extension in lying at home, and for example, they'll do extension in standing at work. With the exercise, it's appropriate for people with back pain that may be referred into the buttock or down the leg, provided that your symptoms after are better or become more central to the spine, so basically go from a big area to a smaller area, or if they come out of the leg and move towards the spine, it usually indicates this exercise is appropriate for you. Also, if the pain becomes easier on repetition, that's a good sign it's appropriate for you. The patient that benefits from this usually reports that their back or leg symptoms are better with walking and worse with bending or sitting. So to do this exercise, just simply in standing, keeping your knees straight. If you bend your knees, it'll take the pressure off your back, which will make it less effective. Place your hands in the small of your back and just arch backwards. Now, if it's quite painful, you want to go just to the edge of the pain. And especially if it's getting easier and less painful, you want to go further with each repetition. If it's not painful, you can move more aggressively to push further back each time. And especially if you're feeling better, you really want to go as far as you can. Now, another version of this exercise you could do, for example, on a plane if you're traveling, where it may not be appropriate to arch backwards on an unstable surface, is if you lean your forearms on the wall, feet about 1.5 feet from the wall, and again, knees straight, extending your back in the same direction. Like the other version of the exercise, you want to push in as far as you're able to, and with repetition you want to go a bit further. Typically 10 to 12 repetitions of this exercise are done in a row, but if you needed 20 repetitions to fully relieve your pain, then you do more. Especially if the exercise reduces your pain but doesn't fully abolish the pain, you may need more pressure. And one such way you can get more pressure is by using something like a stick. It could be, I used a putter, so a golf club, a broom, anything that's small you can put behind you. And the idea is the same, keeping your knees straight, arch back, but then use a bit of a push to get more extension. The other thing you can use is on a bench, maybe a kitchen bench or the back of a ute if you're a tradesman. Basically something that's about mid-buttock height, keeping your knees straight, you put your hands on the surface and again arch back and push to generate more pressure.